Dr. Ryan Anderson joining us from the Heritage Foundation. Ryan, why would you say that everything we hear from the media about sexual orientation, gender identity is really wrong?
Yeah, the report really highlights that two of the most commonly heard claims in the media, that people can be born that way and you can be a boy trapped in a girl's body and a girl trapped in a boy's body, that both of those claims are not supported by the scientific evidence. And yet we see in Justice Kennedy's majority opinion for the Supreme Court last year, he says, the science is now settled, people are born that way, it's an immutable biological orientation. They're saying that's not what the science shows.
So the science actually contradicts that Supreme Court ruling if you base it on that.
Well, it certainly doesn't support it. What they're saying is that we don't know what the origins are of sexual orientation. It's partly biological, it's partly environmental, it's partly experiential. And that people who want to rush to say it's all biologically determined, it's all that way at birth, they're not doing justice to the science.
What would you say is the biggest takeaway from this research?
I think the two of the big takeaways are the claims about the science not being born that way, not being trapped in the wrong body. The other two takeaways, though, are what the outcomes are. They highlight that very poor mental health outcomes for people who identify as LGBT. That's not explainable just because of bias or stigma or stress or kind of negative reactions to that. They say that accounts for part of the bad outcomes, but something else is the explanation here. We have to do more research to find out. And then the last one would be transgender procedures in general, but particularly for children. They say there's no science to support that a child should be encouraged to transition, to identify as transgender, and that even in adults, those who have received transition therapies don't report better mental health outcomes, even though the surgery goes well from a purely physical standpoint.
We're seeing so much policy based on this, and isn't policy based on science, or shouldn't it be?
It needs to be informed by science. The authors of the report, they're both trained as scientists, physicians, trained in psychiatry, so they don't discuss the policy, but we need to be informed as citizens about this. They point out that over 80% of children who experience kind of gender dysphoria will at some point grow out of it. So if they feel stress at their gender at some stage in adolescence, they naturally grow out. We should think, what will school policies do to help prolong that gender confusion if they help encourage people to identify as transgender?
This seems like really solid science. Do you think it will affect public opinion, or will it be dismissed in our culture today?
That all depends. We've seen other pieces of solid science, when they come to politically incorrect topics, be demonized and the authors of the report be attacked. One of the authors of this report was the chair of psychiatry at Johns Hopkins Hospital for several decades. He taught at Johns Hopkins Medical School for several decades. It's hard to attack him. His co-author has taught at over a dozen different top-notch research institutions. He currently is a fellow at Johns Hopkins and a professor at Arizona State University. These guys have good academic credentials. They looked at 200 peer-reviewed studies to evaluate what the literature shows.
Solid science. Dr. Ryan Anderson with the Heritage Foundation, we always appreciate you. Thank you.
Thank you.